And we're back to Staying Healthy with Dr. Dach, office located on 7450 Griffin in Davie, just down the street from the New River Grove. Stop in and have some orange juice and say hello to Bob Roth and the whole family. We're talking about bioidentical hormones for women. Guys out there, this is important information for you also, because remember, your significant other needs this information, and you can pass it on. Let's talk about the word bioidentical hormone. The word bioidentical, what does bioidentical mean? The word bioidentical means the same chemical structure is found naturally in the human body. The same chemical structure that we have in our bodies. Bioidentical hormones are the ones circulating in your bloodstream right now. That's what we have in our body, bioidentical hormones. Yeah. Number two, a very important fact, everyone should be aware of this: bioidentical hormones, that's the ones we have in our bodies, are safer and more effective than chemically altered synthetic hormones. And we know this from a number of studies. For example, the Women's Health Initiative study, which we talked about just before the break, showed that synthetic chemically altered prempro causes cancer and heart disease. That study, which was NIH sponsored, was actually terminated early and halted because of increased breast cancer and heart disease in the hormone-treated group, the group treated with these synthetic chemically altered hormones. What about information? What about studies that show that bioidentical hormones are safe? Where can we find that information? Well, the study that I think is probably the most useful is the French cohort study, which was done in Paris, France, published by Dr. Fournier in Breast Cancer Research and Treatment, January 2008. It was published 3 years ago, entitled Unequal Risks for Breast Cancer Associated with Different Hormone Replacement Therapies. And this was the French cohort study, which looked at women from 1990 to 2002 over, they followed women, 80,000 postmenopausal women over 8 years, and found 2,300 cases of invasive breast cancer occurring in these 80,000 women over 8 years. And what they found was that the breast cancer risk varied significantly according to the type of progesterone they were using, whether it was human bioidentical progesterone or whether it was a progestin like Provera, which is a chemically altered progesterone. And these were women who were using the estrogen-progesterone combination. For women using bioidentical human estrogen and human progesterone, their risk of breast cancer was identical to non-hormone users. In other words, the risk of breast cancer was identical to the general population at large not using hormones. For the women using estrogen combined with a synthetic chemically altered progestin, such as Provera, these women had a 70% increase in breast cancer rate. And again, this is similar. This type of finding is similar to what we saw with the Women's Health Initiative, as well as those 4 other studies which showed increased breast cancer in progestin, chemically altered progestin users. So the bad guy, the culprit here, is the synthetic chemically altered progestin. That's the thing to avoid. And I'm going to quote the author of, Dr. Fournier, the author of the French cohort study. What he says, I'm quoting, "The choice of the progesterone agent is important. Regarding breast cancer risk, it is preferable to use human bioidentical progesterone." And this was published in January 2008, Breast Cancer Research, Mainstream Medical Journal. Excellent review of the safety and efficacy of bioidentical hormones can be found in the 2009 article published in Postgraduate Medicine by Dr. Kent Holtorf. You can also get all this information from my book, Bioidentical Hormones 101. The book is available on Amazon, and it's also available free on my website, which you can get to very easily. The website title is the same as the title of the book, bioidenticalhormones101.com. Bioidentical hormones are FDA approved. I think that's a very important fact. They're bioidentical hormones FDA approved at the corner drugstore, CVS, Walgreens. Here are a few examples: the Vivel dot, estrase, Climera, Prometrium, etc., etc. There's about 20 or 30 different preparations of bioidentical hormones, all FDA approved, that are at the corner drugstore. The next important fact that we must realize is that we can also get bioidentical hormones from what's called a compounding pharmacy. Compounding pharmacies make up drugs to order by hand, and they receive a prescription from the doctor, and they'll then create the formulation. For example, every hospital in the United States has a pharmacy in the hospital that makes up intravenous antibiotics for IV use. And every hospital pharmacy is a compounding pharmacy. Those IV antibiotics, when they inject the antibiotics into the IV bag, they are creating a compounded formulation. And compounded formulations are, by definition, non-FDA approved. That means they do not fall under FDA jurisdiction because they're made to order. There's no FDA approval intended. No FDA approval is requested or even required for compounded medications. So then that applies also to compounded hormones. Hormone preparations that are compounded are not FDA approved because no FDA approval is required or even desired. Compounding pharmacies are regulated at the state level, not by the federal government. If you want to get rid of compounding medications, then you'd have to get rid of every hospital pharmacy around the country, and that's simply not practical. So compounding is here to stay, and when it comes to compounded hormone preparations, it is best to use a large national compounding pharmacy that has the highest quality and the best service. Okay, we've been talking about bioidentical hormones, how they're safer and more effective than synthetic chemically altered hormones. You're listening to Dr. Jeffrey Dach, Staying Healthy with Dr. Dach. You can reach me on my website, drdach.com. And next we're going to talk about what are the symptoms, what are menopausal symptoms that are treatable with bioidentical hormones. One of the things that we want to talk about is that as we age, for all of us, men and women, our hormone levels decline. And in women, this is called menopause. Hormone levels decline, and they actually have hormonal deficiency symptoms, which are quite noticeable and quite bothersome and annoying. And what are these symptoms? Number one, night sweats and hot flashes are very typical symptoms of hormone deficiency occurring after the age of 50 in many women. Number two, trouble sleeping, insomnia, waking up at night, can't sleep. Very common estrogen deficiency, hormone deficiency symptom. Number three, cognitive dysfunction, loss of memory, foggy thinking. Number four, aches and pains in the joints, which is called menopausal arthritis. Number five, dry eye syndrome. The eyes get dry, and this is related to low testosterone levels. This was research that comes from David Sullivan at Harvard, who spent his entire career studying testosterone and the dry eye syndrome. Number six, symptoms of menopausal hormone deficiency include anxiety, panic, and mood disorder. Number seven, dryness and loss of libido. Number eight, menopausal arthritis, which we mentioned earlier. So those are the symptoms that we're looking for that are treatable with bioidentical hormones with excellent relief. Bioidentical hormones are safer and more effective than synthetic chemically altered hormones. One of the great tragedies, one of the great scandals of modern medicine, current day medical practice, is that synthetic chemically altered hormones are handed out preferentially to women rather than giving them bioidentical hormones, which are safer and more effective. Now, another important item is that as we age, as we get older in life, especially after the age of 50,